wanted to say welcome, good morning, good afternoon, good evening to everyone joining us today. Welcome to the webinar on case management information systems, where we will be presenting the Assessment, Planning, and Governance Toolkit. My name is Meg Langley, and I'm a Senior Technical Advisor with Palladium on the Data for Impact project. We'd like to thank our colleagues at USA, the University of North Carolina, Chapel Hill for their support. And on a logistics note, we would like to save the questions for the very end. So please just put your questions into the Q&A box, and we will hold those questions to the very end. Just a note on videos, I'm turning mine on right now for the introduction. Our presenters will turn them on for introductions, and then we're going to turn them off just to make sure that we have a good connection today. So just wanted to say welcome to everyone, and we are excited to get started. Great, so for the agenda today, we will be doing a quick introduction to D4I, and then diving into the CMIS assessment and planning toolkit and pilot, and then the CMIS governance guidance document and pilot. And then, as I mentioned, we'll be having some time at the very end for our question and answer period. So I will be monitoring the chat as questions come in, and we'll save those for the very end. So please feel free while the presenters are talking, you can feel free to enter any questions you have. I'd first like to present today our presenters. So we have first Stuardo Herrera. Stuardo is a technical advisor for data informatics and analytical solutions at Palladium. Stuardo has more than 10 years of experience implementing technology for international development. He has worked for public institutions and international organizations such as USAID and the World Bank, developing digital solutions for child protection, education, and health. He is the informatics team lead of the D4I project, overseeing CMIS and child protection digital strategy development. Our next presenter is Nzyoka, who is the country representative for Palladium in Kenya. She's a seasoned development practitioner with more than 20 years managing development projects in Kenya, South Sudan, Zambia, and Eswatini, working with ministries of health and with funding from USAID, CDC, UNICEF, Helen Keller Foundation, and others. She's a digital specialist and believes in the power of data to transform organizations and communities. Data for Impact, otherwise known as D4I, is funded by USAID and is an associate award of measure evaluation. D4I continues to build evidence to improve health and social systems. And at the global level, D4I works to generate strong evidence for program and policy decision-making, strengthen individual and organizational capacity, and enhance the use of data for global health and social programs and policies. D4I works with governments and partners to strengthen the collection, management, and use of quality routine data to support effective case management, to improve the provision of child protection and care, and also supports the development and improvement of data systems, including case management information systems. As part of this work, we will present today global activities designed to improve the capacity of governments in evaluating digital systems to support child protection and care, and to assess their potential for scale-up and long-term sustainability. This is important because case management information systems provide a way to better serve children. They can track children at risk, arrange alternative care services, integrate support from different sectors, improve quality standards of case management services, and track data in emergencies. Case management information systems can ensure that government agencies that specialize in child protection have reliable case management data to address the needs of vulnerable children and support the case management decision-making process. They can also ensure that caseworkers supporting children have the tools and resources needed to perform the case management functions. Because of the increased interest in advancing digital solutions for case management of children at risk, experts convened in December 2019 to inform the development of a framework for case management information systems centered on child protection and care. Information Systems Framework for the Case Management of Child Protection and Care also known as the CMIS framework, was developed in 2020 and includes lessons learned from those who have developed, implemented, and used such systems and agreed upon best practices. The framework presents 3 perspectives and related processes that should be considered together to ensure a holistic approach to CMIS development. During the development of the CMIS framework, stakeholders identified the main areas a functional CMIS should cover, and also identified areas that countries would need as reference for CMIS. So the work was further developed to look at standardization of government approaches to CMIS development. The goal of standardizing government approaches is to ensure the most appropriate parties contribute, roles and responsibilities of each substructure are defined, decisions align with organizational and national policies, and they are transparent. Also to ensure government information and communications technology and project teams have a method for evaluating digital systems to support child protection and care activities. To address the gaps identified and move towards standardization, the solutions proposed are what we are presenting here: a CMIS assessment and planning tool to guide governments in making decisions with system selection or enhancement, and a tool that guides governments on the aspects they need to consider for oversight and management of CMIS. Now I'm going to hand over to Stuardo to present the CMIS assessment and planning toolkit.
Thank you, Meg. And as Meg said, we want to highlight the importance of the case management information systems to ensure children that are at risk don't fall through the cracks of the system. Really, these case management information systems are super important to ensure that case managers, case workers, and other stakeholders involved in the case management process have tools where they can follow up on cases of individual children, but also systems where they can have data available to make better decisions about child protection policies. And for that reason, we developed these 2 tools. Specifically, now I'm going to present the case management information assessment and planning toolkit. And if we go to the next slide, we will see that designing the architecture and selecting the right technology is a critical process in the case management information system development. So we know the importance of having case management information systems for managing children data. And the first and foremost important decision that we need to make is the architecture that will support this. Government agencies and stakeholders interested in deploying case management information system solutions should consider factors such as interoperability of the system, data ownership, privacy and security, devices and access, data standards, and data quality when they are choosing that technology that will support their case management process. And in some cases, partners and technology providers approach governments with proposed systems that may or may not include all of these considerations or meet their requirements. But because they appear attractive on how they will improve the current inadequate management of data, usually decisions are made on selecting these case management information systems without taking all of these aspects into consideration. Also, it may be that other countries or other government agencies already have a case management info system in place, but they want to assess if they, during the development and during the implementation, they have considered all the different aspects that they need to consider to make sure that the system will be sustainable in time, that they will be able to keep using it and maintaining it even when several years pass. And that's why we created the case management information system assessment and planning toolkit. The main purpose is to improve the capacity of governments to evaluate digital systems to support child protection and care case management activities, and assess their potential for scaling up and achieving long-term sustainability. Also, because each country, government, and case management information system is unique, There is no single way to measure or to determine which case management information system is best for a particular context. So this tool is not in any way prescriptive, but we try to design this tool in a way in which it can guide the decisions, the decision process of governments, and for governments to have different criteria to select their information system based on their unique requirements and their unique context. That's why the focus of this tool is firstly on the context. So the tool first, assess the context and provide tools for government stakeholders to look at the workflows of their specific government and of their specific case management process, to look at the different processes already in place, to look at the different stakeholders involved in their particular situation in their child protection activities. The second perspective that we took into consideration for the development of this tool is the circumstance. That it's for governments to assess what resources they have in place to implement a case management information system. And the third perspective is technical requirements. So once governments know about the context, their specific context, how their specific context is structured, and what are the different variables of their specific context, once they know also in what circumstances they would implement or they have implemented their case management information system, then we are in a good place to evaluate the technical requirements of the case management information system or of different options of case management information system that they want to implement. The tool also includes a guided evaluation system, but mostly, as I said before, the main purpose of the tool is not to be a prescriptive tool, but to be a tool that invites to discussion, conversation around specific topics that are important to consider when implementing a case management information system. Regarding the toolkit format, the toolkit starts by explaining the recommended methodology to apply the assessment toolkit. It's designed to be conducted as a team with representation from ICT experts, child protection experts, also regional and local staff. That's how we've recommended in the tool that the assessment should be conducted. And this is because it's important to have perspectives from different areas, from different sectors. Of course, when choosing any information system, and especially a case management information system for child, it's important not only to have the perspective more about the architecture, but it's also important to have the perspective of the users that will be using the system. Because in the end, they are the sector specialists and are the ones that are going to be using the system on a day-to-day basis. And of course, sometimes in some settings, usually regional and local staff is forgotten. So it's important to take him into consideration to make sure that the system not only provides data to the central levels, but also that so it's important we recommend. Yes.
I'm sorry. You're cutting out quite a bit. I don't know if you're turning away from the mic, maybe.
Okay. Can you listen to me better?
Yes.
Okay, great. Sorry for that. So as I was saying, we recommend that this assessment is conducted by a team of 5 to 7 people, hopefully including these 3 groups that we can see here. The assessment then is divided into, the assessment toolkit is divided into 2 sections. It starts with the organizational self-assessment. This includes two activities, that it's the ecosystem map activity and the resource assessment activity. And the second section, that it's the CMIS assessment, you know, and sections in detail in the next slides. Thank you. The first activity is the organizational self-assessment. And as we saw, the main objective of these first two activities that I'm going to explain is for governments to understand context and the circumstances under they will be implementing the case management information system. So the main objective of the organizational self-assessment and the ecosystem map activity is to help the assessment team understand the context. A stakeholder map is a visualization of all the different stakeholders involved in a particular process and the links between them. It should include flows of information, relationships, influences, and other aspects as well. In the toolkit, we have recommended that this ecosystem map is developed for teams that don't have a case management information system yet. For teams that already have a case management information system in place, the stakeholder map should be created with taking into consideration the workflows of the existing case management information system and corresponding data collection and retrieval processes. A stakeholder map is important for coming to a shared understanding of the context and environment in which the case management information system will be used, which in turn will help determine which features and characteristics will be necessary in the case management information system. So basically, this ecosystem map help us identify who are going to be the different stakeholders in place, what are the relationships between these different stakeholders, how are the data flows between these different stakeholders, and then when we actually evaluate the system, how will the system support these stakeholders and workflows. The next activity of the organizational self-assessment is the resource assessment. Can we go to the next slide, please? Thank you. So when evaluating a case management information system, it is important to know how it will fit into the context and circumstances within which it will function, as I said. In some cases, there may even be aspects about the implementation environment that are non-starters. For example, if there's no budget available for a case management information system. So this second activity of the organizational self-assessment, that it's the resource assessment, focuses on understanding what are the resources available and what are the variables, let's say, that should be taken into consideration when implementing a case management information system. So this section asks a series of questions that government stakeholders and the assessment team should ask themselves about funding, if there's funding for the case management information system, if there are requirements related to data quality, what are the different variables or the different, the context regarding internet and power access, if there's internet and power access available in the local facilities, and if case managers have access to internet and power access, if case managers and other stakeholders entering data into their case management information systems have access to technology, and to what type of technology they have access. If there are specific servers and devices requirements that a specific government agency has. What's the technical staff available? If there's a team that will be able to support the maintenance of the case management information system in that particular country or in that particular government agency. But it also asks questions around information that the team should should have available when they conduct the next activity. And that's why it also includes these 7 sections around the framework. So the team can research about specific, things about system specifications, about if the government agency has system specifications that they should be taken into consideration, if there are, decision-making, requirements or data use needs that they should take into consideration, if there are interoperability requirements in some, and the data exchange between the different government agencies, and so on. And I will explain these sections a little bit in detail in the next one, but this is mostly to say that before actually doing the evaluation of the case management information systems, these 2 first sections help the assessment team understand in what context they are operating. In the next slide, I will explain the CMIS assessment, the CMIS assessment tool that will help the assessment team evaluate the actual case management information system. So now, armed with the results of the organizational self-assessment, the team will be ready to and CMIS fits the specific context and circumstances of the country. The first section is the system specifications. And in this section, basically, questions are asked about, flexibility of the system to adapt to the identified needs, if the developers in charge of the system have the required skills to maintain the technology stack of the. In the second section, that it's around decision making, the assessment team will ask, questions around providing and evaluating what value the case management information system will provide to all stakeholders to make sure that they make the right decisions about child protection policy. Also, if they will have enough detail in the data, if the case management information system that they are evaluating is providing enough detail to make the decisions that they need to make. It also assesses interoperability, the ability of the system to exchange data with other information systems. And it's very important to assess if the case management information system will need to exchange data with other systems, like, for example, the health sector, the education sector, or with the police department, to make sure that case managers have all the information they need about the children. Also, around usability, if the system is easy to use, if it's taken into consideration, the perspective of the users, if case managers, social workers will be able to use it, and if it will be compatible with the devices that they have available. Documentation and support. The documentation is important because otherwise it will be difficult for development teams to modify the system. So it's important to assess if the case management information system that has been offered to them, it's well documented, and if developers will be able to keep maintaining the system, even when the vendor or the organization that developed the case management information system is not present in the country anymore. And privacy and security is, here the team can ask questions if the CMIS data stored in the system is stored in a secure manner, if it's encrypted, if it's password protected, and so on. In the end, each specification has been weighted a certain amount based on its relative importance. And in the end, the scoring of each sub-area will provide information on how that particular area fits within the context. Now we will see the case management information system in action, and we will see an example on how it was applied in Armenia. So first, to give you a little bit of context, the case management information system assessment and planning toolkit was applied in Armenia. And Armenia is a country with a population of 2.9 million people, a child population of 700,000 people, a poverty rate of 33%. You can see there in the next bullet point that it has a fair amount still of children in residential care facilities against the family type care. So they still are managing a lot of cases in residential care. It has a very unique political situation. It has unstable government. It has had 5 ministers of social affairs in 4 years. And it also has a very particular context in terms of a crisis situation, because a lot of displaced families with children have come from the Artsakh state supported by Armenia. So in this context, you can imagine that they have a lot of situation in which case managers need to track adequately children at risk that have been displaced or that have been separated from their parents because of this general situation. So the case management information system assessment and planning toolkit was applied or was conducted because of a very specific challenge. There they have a case management information system already in place called the Manuk system, which is an information system used for registration of children in adversity in Armenia by the Ministry of Labor and Social Affairs. And the government found out that the system didn't respond to the current needs of the users and stakeholders. They had several consultations with users, and the main problems that they were having is that the reporting modules of the information system was implemented to include the monitoring and evaluation subsystem, but that system wasn't generating the routine indicators that they needed to assess if the child protection policy was going on the right way. So when they needed to get more data or they needed more detailed data to find out how the policy was going, they couldn't generate it through the system. In addition to that, users identify various issues with data entry and saving the information. Also, the system started to randomly, without clear trend, reject data. And there were several user issues. So they decided to conduct the assessment to not only identify what was the problem behind these issues, but also to do a comprehensive assessment on where the Manuk system could be strengthened, if there were areas that could be strengthened, or to help them guide their decision. So for that process, they conducted the toolkit, and they started in June of 2021. The process itself included a series of meetings and structured interviews where the assessment team interview users of the Manuk information system, 28 representatives in total. They also interview developers and systems administrator. To conduct the activities of the assessment toolkit, they had a 2-day validation workshop to validate the information with main stakeholders. And in the end, conducting this toolkit ended up in a presentation for the deputy minister. In the end, the outcome is that the ministry agreed to invest in a new case information system because of this assessment, they found out that several areas of the information system needed to be strengthened. If we go to the next slide, we can see, in general, and I would go into detail into each one of these areas, but in general, several of the areas needed strengthening. And the system was built in a very old technology, more than 20 years old. So it was very difficult and in addition to that, it wasn't documented. So it was very difficult to try to modify the system. And now they are in the process, also taking as a base the requirements that were collected during the ecosystem map. They are now developing a case management, a new system that will, cover these case management workflows. In the next slide, there are some, lessons learned from applying the assessment in Armenia. It's important, of course, to involve relevant staff, particularly technical and administrative staff in the assessment, as well as the developers and the support team. As I said, it's very important to have the perspectives of different stakeholders. With a knowledgeable audience, the assessment can be completed in one day. It's very straightforward. Some information is important to, of course, the assessment team to evaluate and to have it before conducting the assessment with a wider audience. But in general, it was pretty easy and quick to conduct in Armenia. The results dashboard that I showed you, it was key to systems where, and that was super important to communicate to other stakeholders that not necessarily were involved in the process. And another good lesson is, if possible, to have the draft ecosystem map ready for discussions and to collect ideas before engaging with a wider audience. And with that, I'll finish. And now I will hand it off to my colleague, Rose, who will explain the CMIS governance guidelines overview.
Thank you, Stuardo. Good morning, good afternoon, good evening, everyone. So I'll take us through an overview of the CMIS governance guidelines. And as we all would know, we often hear that systems rarely fail because of the technology. Often failure is usually as a result of people components. And CMIS governance includes quite a lot of people and process aspects. And therefore, it's really important for governance to be paid attention to ensure that there's ownership, accountability, and that there's planning for CMIS implementation so that sustainability of efforts happens. Next slide, please. So for the CMIS governance guidelines, the document focus is to explain the mechanisms that are used to endorse institutional decisions and to identify the officials that are assigned the responsibility for endorsing these decisions and ensure that you have accountability structures to ensure these officials are held to account for results of the decisions that they make. In the design of CMIS governance, the document talks about ensuring that there's a good representation of people on the table, to include ICT experts, to include child protection experts and leaders in country, leaders both at the national level and at the subnational levels, because these are decision makers and they are people that oversee governance of CMIS, and also to ensure that there's representation of some regional and local staff, because use of this system that's where it happens. The document is divided into two sections, and one of the sections is CMIS governance components, and we'll go into details on what that entails. And then there is a CMIS maturity toolkit or model. Next slide, please. So the purpose of the governance guidelines is to define a framework for large-scale implementation of CMIS and to outline the structures and processes that represent norms, values, and rules for CMIS governance. It also highlights actionable steps that countries can take towards achieving higher maturity levels in CMIS governance, and provides a CMIS governance maturity model, which countries can use to help in assessing and determining the degree of the maturity of their CMIS governance. Next slide, please. So one of the sections, like I'd said earlier, is on components of CMIS governance. And this represents a set of interrelated domains and elements that together or jointly represent a mature CMIS ecosystem. So when you're looking at a mature CMIS, you expect to see these 4 domains and elements in place. On the leadership and coordination domain, you would expect to see that the document outlines what are the roles of leadership in providing oversight for CMIS implementation, led by the relevant government agency. Most of the time, it will be the national level DCS, Directorate of Children's Services, or the agency that is responsible for governing CMIS. This document also outlines in this pillar what are the steps that you can put in place to ensure that you are strengthening leadership and coordination. So in this document, you would find steps that countries need to follow, starting with defining their baseline level of CMIS governance. I will explain later about the maturity toolkit and how it can be used to do that. Once a country has defined its baseline levels, then it needs to define or develop a vision for CMIS implementation, and the document outlines what needs to be considered. It also outlines how you can define country-specific structures for coordination and ensure that these are in place. Some of them include a National Child Protection Technical Working Group and sub-national child protection technical working groups. The guidelines outline who are the players that are supposed to be included in these coordination structures, what are their roles, and how can they how can these structures be held to account to ensure that CMIS implementation is proceeding as planned. It also talks about using data that comes off CMIS, because often if leaders do not use data, often data is not used by other players in the sector. Therefore, it talks about how can leaders ensure that they're using data that comes off CMIS systems so that the systems can be used for perpetuity. The other domain is on policy and planning. And this domain is important because it ensures that CMIS implementation is standardized and it's sustainable. When CMIS implementation is enshrined in country policies and planning documents, it ensures that regardless of who is in place at the leadership level, CMIS implementation continues to happen. So it's an important domain of governing how CMIS implementation happens. So in this document, we have steps that a country needs to follow to ensure that the policy and planning domain are strengthened. And these depend on the maturity level of the country. And later we will be talking about the various maturity levels. But generally, the document unpacks how do you ensure that you understand the legal environment as leaders within the country where the CMIS is being implemented, because it's not implemented in a vacuum. There are countries where there are clear guidelines on what needs to happen to protect children. And therefore, it's important to understand what is the legal environment within which CMIS implementation happens. Here we look at country-specific child protection policies, and the guideline talks about ensuring that CMIS implementation is aligned to global statutes that countries have signed on and country-specific policies that outline child protection and the aspects that need to be implemented to protect children. We have other policy documents such as HIS, ICT, Data Protection Acts, and other relevant policy documents that are important to ensure that CMIS implementation is sustainable. On the data domain, here we talk about what are the various policies that you need to have in place to ensure that data is being governed properly. So here we have various SOPs such as data governance SOPs, data quality assurance plans, data management SOPs, and basically developing guidelines and documents that guide how data is governed. Then we have the ICT domain that outlines what are the various protocols that you need to have in place to ensure that ICT implementation is aligned with the national ICT policies. These policies could include things such as data security and protection, where there's a Data Governance Act or an ICT Act that talks about how ICT interventions are going to be implemented in the country, that there's sustainability, there's scalability of the system, that infrastructure requirements are clearly defined, that scalability is factored, for example, where there's an increase in case workers or cases, then you increase the resources that are needed. Best practices, international best practices for ICT development, such as principles of digital development, which are global good guidelines that outline how can you develop a system following international best practices. And these include things like reuse, ensuring that you don't create when something else exists, instead you strengthen. Things like interoperability of systems. What are the standards that you need to put in place to ensure that this CMIS is sharing data with other systems that are existing? It's sharing data with other sectors. It's pooling or sharing data with sectors that are relevant for child protection. Next slide, please. So the other component is the CMIS Governance Maturity Toolkit. And this is a toolkit that outlines the various structured levels that you can use to assess the maturity of a CMIS. A maturity model has been defined as a set of structured levels that depict organizational behaviors and practices and processes that can be reliably and sustainably produce a desired outcome. So these levels represent maturity of CMISs. Countries would be in various maturity levels. It starts from the lowest, which is the nascent, which is where you have informal CMIS governance structures. These structures have not been formalized, and CMIS activities happen by chance, or they are isolated, or they are ad hoc efforts. Then we have the next maturity level, which is emerging. And here the country has defined CMIS processes and structures, but they are not systematically documented, and there's no formal monitoring of how implementation is happening. Then the third level is where, which is the level that we call established. And here the country has documented CMIS structures and processes. These structures are functional. There is also matrices for performance monitoring and quality improvement, and evaluation is being developed. While under institutionalized, government and stakeholders are adhering to governance processes, and they are following standard practices. Monitoring of implementation is happening, and quality improvement and evaluations are systematically being used. The highest level is where we have optimized, and here government and stakeholders routinely review and modify CMIS governance structures and processes to adapt to changing environments. And there's also full country ownership of implementation and oversight for CMIS. So what we expect is that when you have countries at the higher levels of maturity, well, for example, level 4 and 5, whether there are changes in leadership structures or changes in funding levels or changes in various aspects, CMIS implementation is likely to be sustained. And therefore, the governance document advocates for ensuring that countries are moving higher and higher along the maturity ladder. At the bottom where you have there is the CMIS Governance Maturity Model Toolkit. It is Excel-based, and for each of these levels, it unpacks what are the various areas, maturity areas that you expect to see. and it gives a score. As you can see, the score is both, we have a color code and we have a score. On the right-hand side, you can see, for example, here we have a country that has assessed themselves at level 2, which is emerging. The next period that they do an assessment, you would expect that the maturity has moved from emerging to perhaps established. Next slide, please. So the governance guidelines were piloted in Kenya. It began in June of this year, and we did that for a period of 2 years. Next slide. Sorry, for a period of 2 months. So, and as an overview of the Kenya Child Protection Management System, this system has been developed by the Department of Child Services with support from various partners. The initial development began in 2007, but this platform has been upgraded over time, and it now looks quite different from how it did in 2007. And it supports tracking of vulnerable children longitudinally and geographically to ensure the continuity of care and protection. And it includes children in institutional care. Next slide, please. So during the pilot in Kenya, what we did is we met with various stakeholders. We met with the leaders at the national level that are responsible for child protection. We introduced the guidelines document to them. We introduced the purpose of the pilot and ensured that they understood that what we wanted to do was to gain perspective on how this guideline can be adopted in country and what are the various areas that it can be improved on. So following those meetings, there was an in-house meeting where the various leaders at various levels, child protection experts, ICT representatives, etc., they used the maturity model to assess the CMIS in Kenya. And on the left, you have the various domain and elements, and on the right, you have the scores that were given. You can see that the data component scored the highest at 4.5. The overall score for the CPMIS in Kenya was 3.9 out of a possible 5. Next slide, please. So these are the maturity characteristics that Kenya was able to identify. I will not read each of them because of time, but you can see on the left, we have the domain, and there are various strengths that the team was able to identify in place based on the maturity toolkit and how it unpacks each of those domains. And they were able to identify the strengths in the various domains and the gaps that exist currently. As a result, for example, when you look at ICT, for example, they were able to identify that interoperability still needs to be strengthened because the CPMIS is not interoperable with other systems. So while it's working quite well, while best practices have been followed in its development and deployment, it's still not sharing data with other systems, and this is important to strengthen child protection. Next slide. So in conclusion, we were able to, Kenya was able to define a CPMIS strengthening action plan based on the strengths that were identified and especially the gaps that were identified in the various domains. So now the country has an action plan that it's going to be putting in place to ensure that the governance in the various domains is strengthened. The team also provided us with areas of improvement for the governance guidelines, and these have been implemented in the final governance guidelines. Next slide, please. Back to you, Meg.
Thank you, Rose. Thank you, Stuardo, for the great presentations. I just want to note quickly before we move into the question and answer period that both of these full reports, the assessment toolkit and the governance guidelines that Rose and Stuardo just presented on, are currently available on the D4I website, and we will be sharing an email to everyone here that includes copies of the toolkits, copies of the Excel documents, and also a recording of this presentation. Okay, great. So I think we're going to move into the question and answer period. We're getting some questions that I will go through. I think first off, we have some questions around the ecosystem map for Stuardo. So Stuardo, could you, one of the questions is, what is the importance of school as an entity on the first activity of the ecosystem?
Thanks, Meg. Yes, as I said, it all depends on the context, but in general, in the experience that I have, the school system has been always, a critical part of the case management process, because case managers, social workers need to have information on, how the child at risk is doing in school, right? In their educational area. So that's why it's important as well in the case management information to have data on their school performance. In some countries, the school system is pretty advanced, and there may be systems already in place to track individual students, and that can be linked back to the case management information system for a particular case of a child. In some other places, the school system may not be that advanced, and only paper records may be available. So it's a matter of understanding what resources are available, how the data is available, and then how can we have that data available in the system. But definitely the school system needs to be considered.
Great, thank you. There's another request for more information on the ecosystem map, and I think with that, we would direct you to the report so we can get to some of the other questions here. Another question I think I'd open up to either Stuardo or Rose. How should NGOs approach their own child protection information system implementation and improvements that support the overall digital and analytics goal of government? Rose or Stuardo, would you like to take that one?
I can start. I think NGOs should be, the national agency that's responsible for child protection should lead all aspects of CMIS. That being said, NGOs should align to the country policies and structures and the vision that this agency are set aside for CPMIS. This is because once projects are over, they need to be sustained and they need to be owned by the government agency responsible. And that's why it's important that they are the leaders, that they own, and that they remain accountable for the implementation for posterity. Thanks,
Rose. I think there's another question that I'll give to Stuardo. Are ICT experts as CMS developers obliged to make things possible to facilitate compliance to child protection policies and processes?
Thanks, Meg. Yes, I think that this is a really good question, and I mean the general answer is yes. At the same time, I would encourage case management information system developers and case management information systems implementers to also review the policies, to not only have an exact copy of the in the case management information system, but in general, I mean technology information systems should be a tool that case workers use to make their work, easier or more straightforward, or to have data at a faster pace that they would have with normal paper records, let's say. So case management information systems, the process should be evaluated to really assess that it's not only an exact copy of the paper process, but that it's actually making the process more efficient. So I would say that, yes, definitely it's important to have the system backed up by the compliance and the policies and the processes, but it's also important to assess if some changes need to be done to those policies and processes to make sure that they reflect the benefits that technology can give us.
Great, thanks, Stuardo. Another question, I'll direct this to Rose. What are the steps in ensuring that caseworkers and social workers are ready and well equipped to use CMIS?
So I'll address that generally. The steps are, first of all, the leadership needs to outline a CMIS strategy. And in this strategy, it needs to include staffing and capacity building and how you will ensure that you have the right people in place and you have the right structures and you have the right accountability and responsibility mechanisms in place. Part of the feedback that we got from Kenya that it was that it was necessary to add a component on staffing. And this component is to outline who are the people that are needed at various levels to ensure that CPMIS governance is, and CPMIS visions and strategies are being implemented as they should. And also, what are the capacity building areas that you need and how can this be unpacked and outlined so that countries know what capacity is needed of these various staff members. Thank you.
Great, thank you. These are all the, oh, maybe one more question just came in. Oh, I see a few more now. Okay, we have a few more questions in the Q&A. I think we just have 1 more minute. So if people need to leave, feel free. We can stay on just for a few more minutes and answer just this last 1 or 2 questions that's in the question and answer session. Let's see. Please, can you show the tools that you use in the pilot in Kenya and why in the level of CMIS maturity, we have a process to continue and not to finish the process if we have the final level maturity? Okay, I see. So I think the question is sort of why does it end at the final level of maturity and not move beyond that, I believe is the question. Rose, do you want to touch on that maturity model?
Yeah, and I also saw another question on whether there's agreement or analysis being done before the scoring in the parameters in the model. So let me address those two. So okay. First of all, begin with the analysis for the scoring. So the maturity model is an Excel sheet. It's very detailed and it's self-calculating. So what it has each of the domains and each of them have been unpacked into a way that is very easy for countries to be able to ask themselves the question, do we have this in place? Don't we have it? As they answer those questions, the model is self-calculating and it shows them then what is the answer. So the process is through a discussion. So not one person sits and fills it up. It's a discussion amongst all the stakeholders that are present. They agree on the response that they will give for each of the domain and the questions in the various domains. On the question about the maturity level for Kenya, so like I said, the overall score was 3.9 out of 5. So it's not at the optimized level. There are still a lot of gaps that need to be addressed. And the team was able to identify each of these gaps per domain area. And like I said, they developed an action plan that if it's implemented, it will ensure that Kenya moves from the level it's at now to the optimized level. So there's still work to be done. How long it will take to move from the level that Kenya currently is to optimized depends on the commitment of the leaders, depends on the resources available, etc. Thank you.
Great, thank you. Okay, I think we have 1 more question, I think, in the Q&A, and then we'll close because I think this is a good question. What are the steps in ensuring interoperability of information systems, even if they have different developers? Stuardo, do you want to take that question? And please, if you have questions, could you put them in the Q&A? I'm not monitoring the chat for that. So go ahead, Stuardo, on that question.
Yes, sure. Also, this is a great question. In difference in each particular country. In some countries, there's an agency that harmonizes, let's say, data sharing between government agencies. And usually, a series of data standards are put in place to make sure that the different information systems can speak to each other, so to speak. So a critical step, is first working at a governance level to agree with these other stakeholders that manage their own information systems, what data we need to exchange and in what formats and in what standards we're going to manage that data, or we're going to exchange that data. One of the things of interoperability, it's that one of the advantages of interoperability is that systems don't need to be built in the same technology in order to exchange data between each other. The important thing is that data standards are agreed and that there's, a technology between the systems to exchange that data. Some systems already, offer that layer that provides that ability to get data from other systems. But in addition to that technology, the most important thing is for agreement on the data standards and the way in which data will be shared between the systems.
Great, thanks. I think we have time for just one final question, and that is, has Palladium learned lessons from the recent pilot experiences to improve the assessments and toolkits? Rose, do you want to take that one first?
Yeah. So we have learned lots of lessons. One of the lessons that we learned from Kenya is the need to ensure that leaders are engaged. We also learned that because leaders are very busy, they have very busy schedules, you have to ensure that you plan ahead of time so that you can engage them for advocacy and use of the governance toolkit. We also learned that it's important to add other components, like I had said earlier, components like what staffing levels are needed and what capacity building efforts are important for CMIS governance. We also learned that financing is very critical, and it's probably something that all countries will have to address. Where there's over-reliance on donor funding, it tends to be that efforts for strengthening CMIS are sporadic. So based on the feedback we have received and the lessons we've learned, we have improved the CMIS governance guidelines. And as they are released, they'll be based on the feedback that has been received from Kenya and from other countries as well. Thank you.
Okay, great. Since people are still on, I think we can answer just a few more because there's some really great questions coming in, and we can stay on for a few more minutes as the presenters. I have a question from Robert. It says, in terms of conclusions recommendations, is the toolkit product agnostic? Does it favor open source products, digital public goods, USAID funded or supported products? Stuardo, would you like to take that one?
Yeah, sure. And yes, it's agnostic in the sense that, as I explained earlier, the first and most important thing that the assessment toolkit has specifically is that first assess the context and the circumstances in which that specific government agency or country is operating. So the most important thing is to evaluate what are the specific variables of the context. Another thing that the toolkit promotes is sustainability. And if you want to have sustainability, open source tools make sense out of context in a lot of circumstances. Of course, there are always things to consider around maintenance of the information systems, and if the government agencies have the resources available to maintain information systems, because even if it's global or open source, the resources will be needed to keep maintaining the systems. So all of these things are considered in the first two parts of the assessment toolkit to then help the assessment team make a decision if a specific open source tool is the appropriate fit for them, take into consideration the resources they have.
Great, thanks, Stuardo. It looks like we just have one final question, so I'll let Rose answer this one. Could you just briefly touch on, Rose, why Kenya was chosen as the pilot?
Thank you, Meg. So as we were developing the CMIS governance guidelines, we had a global technical working group that included people from various countries, from various agencies, government, non-government, etc. and there was a representation from Kenya and other countries. One of the things we wanted to do was to pilot these guidelines in a country that is nascent and also in a country that has implemented a CMIS for a while. So Kenya represented that country that had already begun walking the journey of CMIS implementation. So we wanted to see how would the governance document be useful for a country like that. We also had reached out to other countries, including Rwanda and Armenia, to pilot and to represent countries where the journey hadn't been walked for a long time. Unfortunately, because of scheduling and all that, we were not able to do that this year. And we do hope still that we can be able to get feedback from these other countries, perhaps in the next year. Thank you.
Thanks, Rose. Great. Thank you so much. We really appreciate there's, obviously a lot of interest with all these great questions coming in, and we hope with sharing the full documents and tools, you will be able to get use and, dive into this even further. As I said, we will be sharing the documents, the tools, we'll be sharing the recording of this presentation and the slides. And of course, we are always available for more questions. I believe my contact information was included in the invitation, and we'll include it when we send out the resources. So if there's any further questions, feel free to reach out and we'll make sure we get those questions answered for you. So just thanks again. Many people stayed on even beyond the time. So we really appreciate all of your involvement and interest. And thanks again.